Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. The total number of cases remains at 290. One individual is currently hospitalized and there is no one in ICU. 260 individuals are listed as recovered. There are 23 active cases. Yesterday, 245 lab tests were performed, and that brings the total today to 35,820. We've seen a lot of Manitobans step up over the last many weeks to flatten our curve. Phase 1 has been in place for a little over 2 weeks, and again, Manitobans have stepped up to take the necessary precautions to allow us to reopen parts of our economy while taking those measures to protect themselves and the people around them. And so because our numbers have looked favorable, the indicators that we have been tracking continue to look favorable. It's put us in a position to move ahead our transition to phase 2 a bit early. And so as of this Friday, May 22nd, we're going to be increasing the gathering sizes to no more than 25 people in indoor locations and up to 50 people at outdoor locations. And so we're still working on other elements of the phase 2 reopening plan, and we're going to have more information on that later this week. And again, as we transition to larger group sizes, as we transition further along into phase 2, it's still a reminder that it's not a return to normal, that we're still dealing with this virus, and we're still going to need to deal with this virus for some time. So we still need to take those precautions. Washing hands, maintaining that physical distancing whenever possible, and vitally important is to be staying home when you're ill. We just can't have people showing up to work or out in public while they're ill. So stay home, call your healthcare provider. Certainly our testing criteria for COVID is quite broad, and we're encouraging Manitobans with symptoms of respiratory illness to attend one of our testing sites for testing. For those that are in the high-risk categories, those over 65, those with underlying medical conditions or immune compromise, we're still encouraging you to take extra precautions. We know the risk of a severe outcome is higher in those groups. So continue to take all those precautions, hand washing, physical distancing at all times, but you should really try to limit your exposures to other individuals at this time. And so businesses that have questions on how any orders apply to them can visit engagemb.ca, and Manitobans should continue to access our website, manitoba.ca/COVID-19, for up-to-date information on this virus. And so at this point, thanks to all Manitobans, and I'll pass over to Lanette.
I'm Lanette Siragusa, Chief Nursing Officer from Shared Health. Good afternoon. I would like to start by thanking all of Manitoba citizens for their extraordinary efforts to limit the spread of COVID-19 following the public health orders and the recommendations over the past couple of months. And I specifically want to single out personal care home residents and their families and friends for their efforts, their patience, and their understanding over these past couple of months. We know it hasn't been easy, but this commitment has been successful in keeping Manitoba's COVID cases low. So for that, I want to thank you, and I want to talk to you about the personal care home visitor guidelines that we've been working on for the past couple of weeks. As you are aware, we have taken a number of necessary precautions in the past 2 months to keep care home residents safe, including implementing visitor restrictions, enhanced screening, and restricting staff to working at a single site. And we made these adjustments with the health of our residents as the central focus. but we are very aware that the ability to connect with loved ones is important for the health and well-being of our residents. So our goal has been to find a balance for the longer term, and a balance that will enable visits with loved ones to occur with all the necessary precautions in place. Personal care home operators will continue to actively support the ability of residents to remain connected with their loved ones, and they're encouraged to find creative solutions and facilitate virtual visits wherever that's possible, and that might include video chats and phone calls and window visits. But we will also continue to consider new and different ways of enabling connections to loved ones. So now that we have the warmer weather upon us, there is an opportunity to allow increased visitor access for care home residents, and this will be through outdoor visits. Personal care home operators throughout the province have been asked to develop site-specific protocols for outdoor visits between residents and their family and friends. So the guidelines have already been provided to the PCHs, the site leadership, and they have been asked to work with residents and families over the next week to identify visitors that are essential to the emotional well-being of the residents, and to determine duration, frequency, and timing of these visits. Over the next week, care homes will be contacting the families of their residents to share specific details, such as where the visits are going to occur and any other specific details like time of day. And our goal is to have the care homes ready to accept visitors to their designated outdoor space by the last week of May at the latest. Some may be ready sooner than that. And I'll just remind people that this really isn't a return to normal. Visitors will still continue to be screened upon entry for travel history, any known exposure to COVID cases, and symptoms of COVID. If you are sick, if you have traveled outside of Manitoba in the past 14 days, or if you have been exposed to COVID-19, you will not be eligible to visit. All visits will require strict infection prevention and control measures to be followed, including physical distancing and hand hygiene. A maximum of 2 visitors per resident at a time will be permitted, and off-property visits are discouraged unless they are for medical reasons. And indoor visits will remain suspended for now, with exceptions still in place for compassionate reasons and end-of-life cases. And if a case of COVID is confirmed within a facility, care homes will be required to implement their outbreak protocols, including potentially suspending visits temporarily. And we know there likely will be some changes required along the way, but we do believe this is a safe way to slowly and cautiously allow in-person visits to resume while continuing to protect residents and staff in the personal care homes. So I would just ask family and friends of those residents to be patient. The personal care homes are in the process of finalizing their plans, and they will be in contact with you soon to share some of the details. On another note, I just wanted to give you a quick update on our alternative isolation accommodation program. As a reminder, this is a program that provides support for healthcare workers and other Manitobans who cannot safely self-isolate at home, or for vulnerable populations experiencing homelessness who need a safe place to self-isolate. So we can report that 5 people were accepted into the hotel program within the past week. 3 people are currently staying there. And the shelter program received 7 new referrals in the last week, and there are 7 people at that site. The opening of the Thunderbird House on Tuesday, I think that was yesterday, allows us to also work with that population, identify those who are experiencing homelessness, and provide them with a safe place to isolate while they await for their test results or recover from their illness. So on its opening day, Thunderbird House tested 21 people. And with that, we can open up the lines to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this afternoon, from the Winnipeg Sun, Scott.
Hello, Scott Bill from Winnipeg Sun. I want to start with Dr. Roussin on the gathering limit. I guess what's, going from 10 to 25 for indoor events. You've talked before about these kind of, super, I don't know what you call them, super cells or super events where a lot of people get things. I guess what is the messaging still, even with these increases in gathering limits? Obviously social distancing. Is there anything else people need to know about them?
Yeah, and so it's right. So you're referring to some of the super spreader events that have occurred in these close indoor prolonged exposures, and so that's how we know that the predominant way of this virus spreading, and the predominant setting is indoor close prolonged contact. So as our numbers are staying favorable. Just as we, committed to Manitobans, we're going to continue to ease our restrictions, and we felt that given the numbers at this point, this is a good time to do this. But you're absolutely right. This doesn't mean it's a return to normal, that there's no precautions that need to be taken. We still need to ensure physical distancing whenever possible, washing your hands. And again, we will say it over and over again, is that you can't be attending groups if you're ill. And if you're at a group and somebody is ill there, I would suggest you're not stay and be exposed. So the times of heading out when we have respiratory symptoms or fighting through a cold are gone. This is the new normal where we can't be out, can't be at work, can't be in groups, can't be out in public shopping when we have symptoms of respiratory illness.
Thanks. And my follow-up is just the Walmart case from, I guess, over the weekend or May 14th. It reports suggest that this person was symptomatic when working. I think you kind of alluded to that yesterday. Is there any investigation going on into why that person was allowed to work while they were symptomatic?
Not really specifically on that. I think it's our standpoint has always been education, and again, definitely not about blame in any cases, and certainly not this one. And it's like I said, it's I'm sure most of us have pushed through a cold and went to work or went out, and it's just the way things were. But they're just not that way anymore. And so just even mild symptoms, respiratory symptoms, we all have to be on the same page, employers, employees, the public, that we just can't be out and about when we show those symptoms.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin, Mohammed from Radio Canada. I have a question on masks. Now that the federal government recommends to wear a mask as an additional protection measure, whenever physical distancing is not possible, what's your position on that? Is it preferable to have physical distancing with a mask?
Yeah, so this is I don't think this changes much of our messaging, and it's not really a big change in messaging at all. We've always said the most important things are the ones that we always go over. Lots of hand washing, physical distancing, stay home when you're ill. In addition to those things, wearing a non-medical mask is likely to protect the people around you. It's unlikely to protect the person wearing it. So it's an additional measure, but it should not be seen as a substitute for any of those precautions. So there's certain times when that physical distancing just may not be possible. Then certainly that's another option, an added method of protection, but we should make it really clear that it doesn't protect the person wearing it, and it shouldn't make you modify your behavior in regards to any of those other cautions that we always talk about.
Thank you, and have no follow-up today.
From CBC Manitoba, Aiden.
Hi, Aiden from CBC News. A question is for Dr. Roussin in regards to increased public gathering sizes. Has the province considered using the bubble or extended family group approach we've seen in other jurisdictions, and why not use that now?
Yeah, so that's not really been our approach at any time with this. We've never really limited, families from coming together through our orders. Certainly, our public health advice is to limit those type of events. Now we're opening up the group sizes, so again, it's the same precautions. Outdoor meeting is even better. Making sure no one is ill there, being extra cautious around people who are in high-risk categories. But we weren't really going to get into the limiting which households could meet with each other. We were going to leave it to Manitobans to follow public health advice, to limit exposures, and just we're trying to move into this new normal. And I think we're good doing that because Manitobans have already demonstrated that they're following public health guidelines, that they understand the importance of this, and so we didn't really see the need to go through that type of mechanism.
Thank you. And my follow-up, the Assembly of Manitoba Chiefs has criticized Manitoba Hydro for its use of a third-party lab to test employees getting to kiosks for COVID-19, a lab, I think, in forensic analysis, but is not recognized by shared health systems. So why not just use, I know you can book it on even Thursday, so why not just use CADA to test these employees? What's the logic there?
Yeah, and so when we reviewed the plans that were set forth, the requirement for the self-isolation period is probably the biggest, is the most important aspect of that plan. The testing, because it was done on asymptomatic groups, and that it was fell outside of our testing protocols at the time. That's where it was done. One reason why it was done privately. The other one is it's a more rapid test that's available. And so certainly if there was any tests that are inconclusive, then we can certainly utilize our facility for that, and we can still look at options going forward with that as well. But that was sort of the plan that was put forward.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, people might look at this 50-person limit for outdoor gatherings and read into that something about organized sports or softball, but I know there are other orders on sporting activities. So could you perhaps clarify what this means for people who want to go out and play soccer or football or softball?
Yeah, and so right now this is just we came out early to announce these group size, just to reflect to Manitobans that we're cognizant of the restrictions that were in place. They were required, but we're going to lift them as soon as we can, cautiously. And all of those other things that you talk about, where we have more details to share on our phase 2 update, and so that'll be later this week that we can do that. So right now it's the group sizes. The previous orders regarding organized sports are in place, pending our announcement on phase 2, which should be coming later this week.
Okay, and if I could ask, what made you decide on 50 as a number? I know it's hard to draw a line anywhere, but why would, say, 50 be a good number and not 70 or 30?
Yeah, and I think there is a little bit of arbitrariness in these type of numbers, right? So we hadn't dealt with a pandemic like this before, and certainly in the literature you look at, even limiting gatherings to 250 at first was a number that a lot of people landed on, and then you see some jurisdictions going down to 2 at some point. So it's a bit arbitrary. So we just wanted to take a graded approach to it, and felt that going to the 25 and then allowing 50 in outdoors just because the risk of transmission is lower. And so those were the numbers that we landed on that we felt were adequate for this phase.
Thank you.
From CTV Winnipeg, Michelle.
Hi, Michelle Gerling from CTV Winnipeg. I'm wondering, what does the science tell you about potential increases in cases when you increase group size limits? Are we going to be looking out for that?
Yeah, certainly we look at that, and if you look at models in the literature. As long as you still have the physical distancing recommendations, which are followed to some degree, as long as you have those other cautions, and as long as you have adequate testing and contact tracing capacity, these measures are not thought to have a significant increase in cases. And the group sizes, right? It's at the very basic spot of these group sizes. The reason we restrict them is that, say, if you did have a case, then there's many potential exposures, right? And so we limit that with the outdoor setting. And then we also will limit that with the physical distancing requirements. And then this messaging that, if you can certainly meet up with 25 people in an indoor spot. But in addition to that, physical distancing, no one there should be showing symptoms of illness. And I just think it's not going to be accepted anymore to be in a group where somebody is visibly ill, and that's going to really allow us to continue with our reopening strategies.
Great. I have a question about kids. Have you guys at all considered the effect on children's mental health and the long-lasting effects that something like a pandemic could have?
So yes, so we're looking at a number of unintended consequences of the pandemic itself, and unintended consequences of our public health measures. So it's certainly we realize it from the beginning, right, that health isn't just about this virus. Health just isn't about health care. And so there's a lot of factors that go into people's health. So we're looking at that. Some of these are going to be difficult to measure, right, because they might be long-term effects. And so we are looking at ways to try to study that. I think there's probably work done in multiple jurisdictions and multiple levels trying to look at some of these unintended consequences. And so it's going to be important work to look at. But I think that for the most part, with the pandemic that we were facing, a lot of the measures were required to move forward with them.
From City News, Stephanie.
Hi there, Stephanie Wilson with City News. Mr. Siragusa, I know you said you want to balance these long-term care homes with safety and allowing residents to see visitors. I'm just wondering kind of how it will look like concretely. Will there be a supervisor at every visit? I guess what can visitors expect to see or have happen when they get to the care home?
Yeah, that's a good question. There are at least 127 licensed personal care homes, and they all have different physical layouts. So we've left that decision to the actual operators at the site to determine how it works best for them. It may be supervised visits, it may be a volunteer is around to support that work. So we've left that up to them to decide and work with the families and the residents as to what would work best.
And just a follow-up, are you guys worried at all about testing numbers potentially going down? As Manitobans kind of understand, we haven't seen a new case in a while. We've seen low numbers of cases and maybe are not as keen on getting tested themselves, and maybe just assuming that what they have is a regular illness and not COVID.
So we're going to continue the, our messaging that Manitobans that are experiencing symptoms of respiratory illness to certainly get tested. We're going to continue with our testing of symptomatic hospital admissions as well as a form of some surveillance. Right, we know that typically 10 to 15% of COVID cases require hospitalization. So it's also another indicator of community transmission. And so we'll keep that messaging out. We're looking at certain ways to try to keep the numbers up. I think it's important to case find the spot that we're in right now. We need to find cases early, be aggressive with the isolation and contact investigation, and then we'll hopefully keep our our trend going.
From the Winnipeg Free Press, Kevin.
Hi, Kevin Olson, Free Press. Just had hopefully a little bit more of a question about the group size for indoors as far as the 25 for Manitobans hearing that. Can we say at this point, are we talking about kind of enhanced house parties if there's distancing, or are we talking about if a restaurant is able to open, are we talking about something like that?
Right. So so this is the public gatherings. And so the limitations on businesses are still in effect from phase one, and then we'll have more details on that moving forward in phase two. And so right now we're talking about things in the house. It's all those precautions. It's limiting the close prolonged contact, and making sure that we're all being cognizant that we certainly can't be going over to someone's house, our friends or family, if we're showing signs of illness. So we need to be careful with this, but it's it is a time that we're now loosening these restrictions, so Manitobans can start this very gradual, cautious return to what will likely be a new normal for the foreseeable future. But some of that messaging is loosening up.
And as you were saying at the conference today, as far as long-term care, that unless it's a catastrophe reason, you won't be able to go inside. It'll be outdoor visits. Another one we haven't heard about is the day program. It's for adults with disabilities. Any sign of where that's at? Was that part of phase two, or is that still further down the road?
As far as visitation?
As far as starting up again, sort of similar to, I guess, the daycares right now have opened up for care workers or people who need them to be able to go to work.
Yeah, and so I mean, this is again something that we're looking at as we open the phases, doing it cautiously, and then again going to have a lot of those cautions in there, just like in the other settings, in the childcare settings, we have that advantage of being able to screen clients coming in to a lot of these programs, and so again, if we practice physical distancing whenever possible. And as well as ensuring that ill people aren't showing up, either employees or or clients, we're really reducing our risk. So that's something that we'll continue to work on.
From Global, Marnie.
Good afternoon, Marnie Brent from Global News. Dr. Roussin, if maybe you can just confirm this. I'm guessing that the size limit would enable people to have smaller or outdoor weddings or church services or funerals as long as physical distancing measures are in place. How would that size limit be monitored, as well as physical distancing measures at events like that?
And so it's the same as we've been doing right now. The size, allowable size limits are in the public health order, so they could be subject to enforcement. We've seen bylaw officers looking at that. Public health inspectors can be involved with it. So, but again, for the most part, people are following advice. Our numbers are showing that. And so we're signaling now that we're at a time in Manitoba where we can start loosening some of these restrictions, and we think we can do so safely. We're going to follow it very closely, but we've relied on Manitobans to follow this advice, and certainly Manitobans didn't let us down.
Thank you. And my next question is actually just for Lanette on the personal care homes. If there is no supervision on some of these visits, is it a concern that people won't physical distance when visiting with their loved ones? I'm sure a lot of people want to hug their loved ones that they haven't seen in a long time. Can you just kind of provide a comment on if that's a concern and advice to people who may be excited to see somebody they haven't seen in a very long time?
Yeah, I would reiterate what Dr. Roussin said. We are trusting people that they want to keep these numbers low. They want to keep their loved ones safe. And certainly we trust that they are going to follow those physical distancing measures, and that includes not having prolonged contact. Yeah, and some sites may choose to have supervision. It's not a mandatory requirement from our perspective, but it may be something that they feel is important to have in place. But really, we're just trusting that the communication and the education that we've been sharing over the last couple of months, people understand that and respect that and will follow.
From the Brandon Sun, Colin.
Hi. I was wondering, we just ran a story about an employee at a home care company getting tested positive, and on a related matter, we were wondering if you could tell us how many healthcare workers or workers in related fields have been tested for COVID-19 in the Brandon area.
Yeah, I don't think I have that down to the region. So I think we do have numbers on healthcare workers that have been tested overall, um, which I can get for you. So there was yesterday there was 22 tested with 22 negative, and then since April 10th, there's been 3,848 healthcare workers tested since April 10th.
And that's in the entire province?
Entire province, though. I don't have a breakdown per region.
Okay. And my follow-up question is on a different note. With more people allowed to be gathering inside, does that mean that restaurants will be able to resume some kind of limited dine-in service?
Yeah, so for as far as right now, the restrictions on businesses remain from phase one, but we're going to get some more details out later this week on exactly what phase two is going to look like, and what it's going to look like for restaurants as well.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, we're hearing that smaller independent gyms are really hoping they're able to kind of open up sooner rather than later, saying they are able to maintain really good sanitization levels, especially for some smaller private facilities kind of run by the owners with a smaller client base. What do you see as kind of being the biggest challenges when it comes to opening up gyms? I know those are currently scheduled in sort of the future phases with no deadline.
Yeah, I think it was, with the phase one, we just couldn't open everything up, and so we did what we thought was safe, and then followed those numbers. And now, as we move into phase two, we're going to have something to announce on that topic later this week.
Okay, and then as a follow-up, it's kind of we're well into the reopening plan and testing is expanded, and we're still seeing really no new cases. Is it possible that the virus could kind of just be dying off here? Is that an option or no?
Well, I mean, we don't know a lot about the virus. We don't know if there's seasonality to this virus. There are many endemic coronaviruses that we see here in flu season and fall time, and they show some seasonality. But we don't know that here. So we need to be cautious. And my take on it is that this virus isn't gone. This virus is still in Manitoba, and we could see these numbers climb if we don't maintain our actions. But in saying that, because we've all learned a lot about what it takes to protect ourselves against this virus, and because the transmission is so low right now, it is safe to start loosening these restrictions. It is safe to move into phase two. And so, but we still need to be cautious. We still need to take those physical distancing is important. And again, I don't think I can state it enough is that we can't be out and about when we're showing respiratory symptoms. You can't just fight through a cold and show up to work with a cold or go out doing the grocery shopping when you have a respiratory illness. We're really going to rely on Manitobans to stay focused on those symptoms. If you develop any of those symptoms, get tested, but don't be out in public.
Thank you. We have a few moments left. If our reporters have any remaining questions, please ask them now.
It's Kevin at Free Press again. That one sort of follow-up to the long-term care homes. Are we just talking about the personal care homes long-term, or are we also talking about that if a patient happens to be in a hospital and they're not in intensive care, would they be allowed to come outside to visit with family, or a St. Amant situation to come outside?
Yeah, our focus originally was for the personal care homes because that is their long-term home. But we do want to look at the acute care, the hospital sector as well. That wasn't our focus because it is normally a shorter term stay. But I think we're going to continue throughout this process to evaluate and adapt the guidelines so that our new normal is still safe for people, but also allows that social connection as much as possible. So that's on our list of next steps.
Diana from CJOB, just a quick question on some of the data that was released later yesterday on the website. I'm seeing it says there was one COVID-19 outbreak in a long-term care facility. Just to clarify, what was that?
Yeah, so we classified that as an outbreak, but there was really minimal. There was 2 cases with questionable overlap between them, and so we decided to label that as an outbreak, and that was early. That was not sure the dates, but we're well past the 2 incubation periods for that outbreak.
Dr. Roussin, Marnie Brent from Global News. I just had a question about this idea of travel bubbles that we're hearing and seeing in some parts of Europe where you can only travel to 3 certain places. When it comes to loosening restrictions on travel and the mandatory 14-day self-isolation, is that something like that a consideration here? Like, for instance, letting Manitobans travel to, say, only Saskatchewan and Alberta without the 14-day isolation, but not to Ontario, Quebec. Is that a possibility here?
Well, nothing's ever been off the table as things develop. Right now, that's not something we're looking for. We feel that the numbers in Manitoba are favorable. We're discouraging non-essential travel outside of Manitoba right now because we know that one of the biggest risks to Manitobans right now is the importation of the virus. So we want to reduce the non-essential travel. And so we'll keep that 14-day self-isolation on for the foreseeable future. But as the epidemiology changes, then we could certainly look to shift those orders.
Diana from CJOB again, just to clarify on that outbreak, where was it and what was sort of the outcome for the 2 people who were infected? Were any of them sent to hospital?
Well, there was just the 2 cases. There was one death that was related to that outbreak, and then the other was a recovery.
Dr. Roussin, Scott Billick here from Winnipeg Sun. Do you believe there will be a second wave of this virus, maybe come the fall? And if so, what is the province doing to, I guess, kind of prepare for something like that?
Yeah, so we don't know, but we're certainly anticipating that and planning for that. And so the biggest issue with that is that if we see this virus co-circulating with the influenza virus. And so we know that influenza alone often puts a strain on our healthcare system. So if we see a co-circulation between these viruses, then we need to be prepared for that. And so which means that we're going to need to have a very robust influenza vaccination campaign this year. We've seen year-over-year growth in our uptake of influenza vaccine, and we're anticipating a much higher uptake this year. And so we'll, again, need to get those vaccination numbers up. We're in a new normal. And so, again, we're not going to see people showing up to work with flu-like symptoms. We're going to continue to have many of the restrictions and personal care homes at that time to limit the amount of outbreaks of influenza that we see every year. But that's going to be the real challenge if we see a second wave of this, if it corresponds with flu season. We'll need to ensure we're prepared for that.
And this concludes today's media briefing. Thank you.
Thanks.